Acute myocardial infarction, commonly known as a heart attack, is a life-threatening emergency that occurs when the blood supply to a portion of the myocardium is interrupted. A myocardial infarction usually results from rupture of the plaque that is found within the wall of a coronary artery, releasing its cholesterol core into the lumen of the artery. Interaction between platelets and the plaque initiates a blood clot or thrombus, which obstructs the blood flow through the artery. Blood flow to the myocardium distal to the clot ceases, with the affected myocardium becoming ischemic. Ischemic myocardium is unable to function normally, becoming injured and eventually dying if the blood flow is not reinitiated promptly. Ischemic heart muscle becomes hyperexcitable and can trigger irregular heartbeats, which may result in sudden cardiac arrest. It is possible today to survive a myocardial infarction with little to no permanent damage to the heart if you get into the hospital's emergency department within the first 2 hours after the event. One of the procedures used to reperfuse the injured myocardium is a primary balloon angioplasty, in which a catheter is advanced from the femoral artery into the obstructed coronary artery. A balloon is inflated, which then reopens the artery. The balloon is deflated and the catheter is removed, leaving behind a metal stent, which is impregnated with an anti-rejection drug to prevent reocclusion. A second procedure involves the injection of thrombolytic drugs directly into the obstructed coronary artery, which act to dissolve the blood clot. In both cases, the procedure is most successful if performed within the first 2 hours after the onset of signs and symptoms of the clot forming. In this scenario, the patient has a history of angina and begins to feel discomfort. Dr. Larry Prince can tell us about this.
This patient had a history of angina. When he quickly sat up in the chair and expressed heaviness on the chest, I had concern. Angina? Okay, you got it? You got the chair up. If you just want to lean back and just relax there, Will. Give you a couple minutes for that to take action. When he made the statement, "Doc, this is not angina," I really had concern. I'm starting to feel numb over here?
Yeah, this is different.
Is it different?
Yeah, Dr. Bear called an ambulance.
Great. Get Audrey on the line. Both the patient and I agreed that it was more than angina. We went into a full emergency mode. We activated 911, got the emergency kit ready. Get the emergency medical kit, the oxygen, and the AED, Greg.
Oh, really helps.
In the pre-hospital setting, while waiting for the ambulance, there are 4 interventions that may be employed. The acronym for this is MONA, M-O-N-A. MONA is morphine, oxygen, nitroglycerin, and aspirin. Morphine is classically administered intravenously to manage the pain of an acute myocardial infarction. In most dental offices, neither morphine nor the intravenous route will be available. However, many dentists do have nitrous oxide and oxygen. A 50% concentration of each drug is as effective as the intravenous administration of morphine for the pain of an acute myocardial infarction. At this concentration, nitrous oxide oxygen raises the pain threshold, sedates a scared patient, and delivers 2.5 times ambient levels of oxygen. If nitrous oxide oxygen is not available, oxygen must be administered to the patient.
We're going to get you some oxygen. That's going to help you breathe better.
A 5-liter flow of oxygen, either by face mask or nasal cannula, will help in the delivery of more oxygen to cells throughout the body, including muscle, brain, and to the myocardium that is not affected by the occluded coronary artery. If no contraindications exist, administer 1 adult aspirin tablet to the patient, 325 milligrams chewed, then swallowed.
Chew it up well and swallow it.
Aspirin has thrombolytic properties. In approximately 20 minutes, it'll prevent the blood clot from getting any larger. Always remember that many people have contraindications to the administration of aspirin. The most common is allergy. In these situations, do not administer aspirin to that patient. The patient with an acute myocardial infarction is conscious and feels terrible. Their pain becomes crushing and increasingly intense, commonly a 10 on a scale of 1 to 10, with 10 the worst pain ever experienced. The pain often radiates to the upper epigastric region, which is the stomach, causing a feeling of being bloated. It may radiate down the left arm, usually as a tingling sensation that occurs in the pinky finger. It may also radiate to the left side of the neck and the left mandible. These are the classical radiation patterns of ischemic myocardial pain. The patient suffering a myocardial infarction is conscious. The skin is normally an ashen gray color. Their mucous membranes may become cyanotic. They are diaphoretic and they're extremely uncomfortable. Yet the most important thing is the patient is still conscious. Even though it's damaged, the pump, the heart, is still functioning, supplying at least an adequate supply of blood to the patient's brain. Once the paramedics arrive on the scene, they'll start an IV. They'll monitor the victim's heart with an electrocardiogram and deliver appropriate medications, transporting the patient to the hospital for definitive care.
Nitroglycerin. He's had 325 milligrams of aspirin. He says that this is different.
This is different?
This is,
so
yeah.
You've had angina before?
Yeah.
Give me a blood pressure. Will, you think you can move over to this bed for me? Yeah. We're going to have to move this bar. How does this arm? Hang on just a second. Let's move this arm. So, have you been getting sick at your stomach, short of breath?
Yeah, it's hard to breathe.
Hard to breathe?
Okay.
Okay. Well, we're going to take good care of you. Have you ever had a pain like this before?
No.
This is new?
Yeah.
Okay, we're going to do a few things. Can you move your arm for me for just a second? We're going to put you on the monitor. We're going to do a 12 lead EKG. We're going to take all this stuff and move it for just a second. Let's do a 12 lead. How long has it been since he had his last nitro?
It's been about 5 minutes.
Okay. Vanessa, give me that blood pressure, and if it's good, go ahead and grab the nitro for me. I'm looking for a blood pressure of over 100 systolic. Okay, well, my name's Doug. This is Vanessa. We're going to take good care of you, okay?
Having trouble with that arm, sir?
Yeah,
What's going on?
tingly. It's
Tingling?
numb, yeah.
Okay. How old are you?
55.
55.
Yeah.
Do you smoke?
No.
Okay, have you taken any sexual enhancement drugs such as Viagra, Levitra, or Cialis?
No.
No?
No.
You sure?
Yeah.
Okay.
No.
130 over 80, Doug.
Okay, good. Go ahead and grab my nitroglycerin out of the top pouch, same place as the blood pressure cup.
Okay. Do you want aspirin too?
He's already had aspirin, so let's hold off on that.
Okay.
And if you can help me get his shirt unbuttoned so we can get this 12 lead done,
Sure.
I'd like to get that done as soon as possible.
Do you want me to go ahead and administer the nitro?
Yes, that's fine.
Okay. Right. This is going to go under your tongue. What I need you to do is open your mouth, lift your tongue up. There you go. It might give you a headache. You're probably going to have a bad taste in your mouth.
You may need to get the morphine ready. If this
Okay.
doesn't help, on a scale of
Hold
1
on,
to
I'll pull your
10,
shirt up. We're going to need it.
on a scale of 1 to 10, 10 being the worst pain you've ever had, 1 being nothing, where would you say this is at?
It's 10.
It's a 10.
Yeah.
All right, we're going
You're
to
going
get
to
you.
feel me sticking some stuff on your chest, okay?
Yeah.
Maybe on him also.
Is there anything I can do? Let me know.
Okay, doctor. What was going on just before this started happening?
We were just doing a routine examination of his mouth,
Okay.
and he just raised up, complaining of the pain.
Just started. Okay, just came on all of a sudden. Okay, you've never had a heart attack before?
No.
You're set
Okay.
up.
Okay, well, I want you to hold very, very still for me. it's hard to breathe. Is that oxygen helping at all?
Yeah.
Did that nitroglycerin help?
No.
Not really? Okay. Just the IV bag, and we'll hang it here. So him having nitrogen aspirin and everything. You said you've never had a heart attack before?
No.
Well, today may be your day. All right, Vanessa, just as soon as you get that, we need to go. I want to transmit this slowly to the hospital. It looks like you may be having a heart attack.
Alright.
Will, I'm trying not to scare you, but it looks like you definitely may be having a heart attack, okay? And we're going to take you to the hospital.
What would I have done different? I probably would have administered nitrous oxide and oxygen at a 50-50 rate. It would have helped him with the pain from the attack. I would have probably administered 2 sprays of nitroglycerin and just managed the situation. A large percentage of MIs occur during sleep or rest, and most aren't stress related. Therefore, it's difficult for us to predetermine when one might occur.
I got this if you want to go. Thank you, doctor. We'll take
Thank you.
care of him.
Thank you.